Dear students, in the previous episodes on riboflavin, you have understood the history, food sources, structure and chemical characteristics, distribution and metabolism. Now, in this episode, I, Dr. C. Anita, will detail you regarding the vital role played by riboflavin in human body, its requirement and deficiency disorders. Let us start with an introduction to riboflavin. Riboflavin is an essential human nutrient that is heat stable and water soluble flavin belonging to the vitamin B family. Riboflavin is a precursor of coenzymes flavin mononucleotide and flavin adenine dinucleotide. These coenzymes are of vital importance in normal tissue respiration, pyridoxine activation, tryptophan to niacin conversions, fat, carbohydrate and protein metabolism, and glutathione reductase mediated detoxification. Riboflavin may also be involved in maintaining erythrocyte integrity. This vitamin is essential for healthy skin, nails and hair. Let us get to know the recommended dietary allowances and requirements of riboflavin for different age groups. After listening to this episode, you will be able to understand the recommended dietary allowances and requirements, explain the functions, discuss the deficiency disorders and its diagnosis, learn the methods followed to assess the availability of riboflavin. Let us get to know the recommended dietary allowances and requirements of riboflavin for different age groups. Requirements. While prescribing the dietary recommended allowance for a given nutrient, the intakes of all the other nutrients are also considered to be at a safe level. Recommended dietary allowance also depends upon the calorie intake. The requirements have been established by depletion and repletion method studies conducted on humans employing appropriate biochemical or clinical parameters to indicate deficiency. That is, the minimal quantity required to cure arabinoflavinosis and also erythrocyte glutathione reductase levels. Balanced studies in humans show a clear increase in the urinary excretion of riboflavin as riboflavin intake increases, with a sharp and continuous rise in the excretion at intakes level above 1 mg/dl. Such studies have also highlighted the speed with which tissue riboflavin depletion occurs and repletion occurs in the same speed. An addition of 0.3 mg in pregnancy and 0.5 mg during lactation to cover increased tissue synthesis for fetal and maternal development and riboflavin secretion in milk has been recommended. The adequacy of riboflavin intakes by population groups can be evaluated in terms of daily dietary intake or with the use of biomarkers of status. Riboflavin depletion during gestation in rats and mice leads to fetal reabsorption. There are reports from as early as 1940s of various congenital malformations associated with riboflavin deficiency in rats and mice. Transient riboflavin deficiency has been documented in infants born prematurely, although no functional deficits has been described. The functional significance of poor riboflavin status among adolescents is not yet known, but there may be implications for the handling of dietary iron, which would be important for the 50% of 15 to 18-year-old girls who have iron intakes less than the lower reference nutrient intake. Now let us come to the recommended dietary allowances. As you can see the table displayed on the screen, the recommendation given for man sedentary worker is around 1.4 mg/day, moderate worker for 1.6 mg and heavy worker it is 2.1 mg, while for women sedentary worker it is 1.1, moderate worker it is 1.3 and heavy worker it is 1.7 mg/day. Pregnant women has an additional requirement of 0.3 milligrams, while lactating women from 0 to 6 months has got addition of 0.4 and 6 to 12 months 0.3 as an addition riboflavin based on their work. Infants from 0 to 6 months require around 0.3 milligrams per day, while 6 to 12 months require 0.4 milligrams. Children between the age of 1 to 3 years require 0.6, 4 to 6 years require 0.8 milligrams, and 7 to 9 years require 1 milligram per day. Boys between the age group of 10 to 12 years require 1.3 and girls of the same age require 1.2 milligrams respectively. Again, boys between the age group of 13 to 15 years require 1.6 milligrams, while girls of the same age requires 1.4 milligrams per day. Boys between the age group of 16 to 18 years require 1.8 milligrams, while girls require 1.2 milligrams per day. Functions. Riboflavin is a constituent of two biologically active coenzymes, riboflavin monophosphate or flavin mononucleotide and flavin adenine dinucleotide. The riboflavin coenzymes FMN and FAD function in redox reactions. They either take from or give substrates electrons in the form of hydrogen atoms. The enzymes are required for the completion of several reactions in the energy cycle by which ATP is generated. They are required in many critical enzyme reactions of metabolism, like passing hydrogens into the electron transport chain, participating in the breakdown of fatty acids to acetyl-CoA, forming the vitamin B6 coenzyme, synthesizing tryptophan into niacin, and participating in folate metabolism and antioxidant defenses, etc. Flavin adenine dinucleotide and flavin mononucleotide dependent act as coenzymes in hydrogen transfer reactions. The primary coenzymes form of vitamin B6, that is pyridoxyl phosphate, is flavin mononucleotide dependent. Flavin adenine dinucleotide required for the production of pyridoxic acid from pyridoxal by pyridoxine 5-phosphate oxidase. Oxidation of pyruvate, alpha-ketoglutarate and branch chain amino acid requires FAD in the shared E3 portion of their respective dehydrogenase complex. Fatty acyl-CoA dehydrogenase requires FAD in fatty acid oxidation. FAD is required to convert retinol, that is vitamin A, to retinoic acid via cytosolic retinal dehydrogenase. Synthesis of an active form of folate from 5,10-methylene tetrahydrofolate by methylene tetrahydrofolate reductase is FADH2 dependent. FAD is required to convert tryptophan to niacin, that is vitamin B3. Reduction of oxides from reduction of the oxidized form of glutathione to its reduced form by glutathione reductase is flavin adenine dinucleotide dependent. Riboflavin deficiency might interfere with high iron handling and thereby influence hematologic status. The mobilization of iron from the intracellular protein ferritin is a reducing process. Reduced flavins can evidently reduce and thereby mobilize ferritin iron in a variety of tissues at a rate that is physiologically relevant. Intervention studies in humans further support the idea that riboflavin status might influence iron handling, possibly including effects at the level of iron absorption. Correcting a riboflavin deficiency in pregnant or lactating women, adult males and school-age children improved the hematologic response to iron supplements. Recent work has shown that even when riboflavin is supplied to tissues intraperitoneally, the absence of riboflavin from the lumen of the gastrointestinal tract from the time of weaning leads to disruption of normal gastrointestinal development. Riboflavin plays a role in thyroxine metabolism and riboflavin deficiency may contribute to the pathophysiology of some mental illness via this route. An early report of personality changes in riboflavin deficiency has been substantiated. Riboflavin does not have significant inherent antioxidant action, but powerfully antioxidant activity is derived from its role as a precursor of FMN and FAD. Riboflavin strengthens the immune system and maintains the healthy digestive tract. It also promotes the immunity and protects the body from infections and diseases. Inadequate amount of riboflavin in the body increases the levels of homocysteine. The high levels of homocysteine increases the risk of heart attack, damages blood vessels and raises blood clotting. Glutathione is an enzyme in the body that is a powerful scavenger of free radicals. Like any other antioxidant molecules, glutathione also needs to be recycled. Riboflavin helps to allow this recycling to happen properly. Another important role of riboflavin or vitamin B2 is it to maintain supply of vitamin B3, that is niacin. Tryptophan is the precursor of niacin and body converts tryptophan into niacin. This process is done with the help of riboflavin and chironin monooxygenase. Riboflavin is also helpful in the absorption of other minerals, vitamins such as iron, folic acid and other vitamins. It also has a protecting nature for nervous system and regulating thyroid activity. Riboflavin is important for the growth of body tissues such as eyes, mucous membranes, skin, hair and nails. It is also essential for the formation of red blood cells. Riboflavin or vitamin B2 play an important role in the treatment of anemia, cataract, migraine, rosacea and vaginitis. To summarize the functions of riboflavin, vitamin B2 helps break down proteins, fats and carbohydrates. It plays a vital role in maintaining the body's energy supply. Riboflavin helps convert carbohydrates into ATP. The human body produces ATP from the food and ATP produces energy as the body requires it. The compound ATP is vital for storing energy in muscles, maintaining the mucous membranes in the digestive system, maintaining of healthy liver, converting tryptophan into niacin, an amino acid, keeping the eyes, nerves, muscles and skin healthy, absorbing and activating iron, folic acid and vitamin B1, B3 and B6, hormone production by the adrenal glands, preventing the development of cataracts, fetal development, especially in areas where vitamin deficiency is common. Now, students, it is necessary to know the ways of preventing losses of riboflavin during cooking. Retention of food values. Milk is a good source of riboflavin. When milk is pasteurized or evaporated or dried, accounts for 10 to 20% of loss. When milk is exposed to sunlight, for example, clear glass bottles, 3.5 hours, it loses around 75% of riboflavin. When meat is steamed, roasted or braised, retain more than 3/4 of the riboflavin. Because riboflavin is sparingly soluble in the usual cooking procedures for vegetables, do not contribute to much loss, but addition of alkali when added to preserve green color, then the losses occurs. Vitamin B2 is surprisingly stable to heat and refrigeration. One recent research group found a negligible loss of vitamin B2 over 3 days of refrigeration. Historically, vitamin B2 was believed to be the heat stable fraction of the vitamin B. That said, there is some loss of vitamin B2 with prolonged cooking techniques. Students, now let us discuss about the deficiency disorders of riboflavin. Riboflavin deficiency, also called as arabinoflavinosis, results in stomatitis including painful red tongue with sore throat, chapped and fissured lips and inflammation of the corners of the mouth, that is angular stomatitis. glossitis, and increased vascularization of the cornea. The lips and tongue assumed a purplish red and shiny appearance. There can be oily, scaly skin rashes on the striatum, valva, filitum of the lip or the nasolabelli folds. Ocular manifestations may be among the earliest signs of riboflavin deficiency. The eye becomes sensitive to light and easily fatigued. The eyes become itchy, watery, bloodshot and sensitive to light. There is also blurring of the vision and soreness of the eyes. An increased number of capillaries may develop in the cornea and the eye becomes bloodshot in appearance. Due to interference with iron absorption, even mild to moderate riboflavin deficiency results in an anemia with normal cell size and normal hemoglobin content. This is distinct from anemia caused by deficiency of folic acid or cyanocobalamin, which causes anemia with large blood cells. Deficiency of riboflavin during pregnancy can result in birth defects including congenital, heart defects and limb deformities. Subclinical riboflavin deficiency may contribute to increased concentrations of plasma homocysteine with an associated increased risk of cardiovascular disease. It may also be associated with impaired handling of iron and night blindness. Signs of vitamin B2 deficiency can include anemia, fatigue, nerve damage, a sluggish metabolism, mouth or lip sores or cracks, skin inflammation and skin disorders, especially around the nose and face, inflamed mouth and tongue, sore throat, swelling of mucous membranes, change in mood such as increased anxiety and signs of depression. Students, now let us get to know about the assessment of availability of riboflavin and its diagnosis. The most sensitive method for determining riboflavin availability is to measure the activity of erythrocyte glutathione reductase, an enzyme required for FAD as a coenzyme. The method is based on the reaction glutathione in its oxidized form is designated GSSG and in its reduced form GSH. In cases of riboflavin deficiency or marginal riboflavin status, the activity of glutathione reductase is limited and less NADPH is used to reduce the oxidized glutathione. Cellular riboflavin concentrations and urinary riboflavin excretion also are used to assess the status. Diagnosis. There are a variety of methods available for analysis of riboflavin and its derivatives. Bioassays measure the growth effect of vitamin but lack the precision of more sensitive analytical procedures. Fluorometric procedures take advantage of the inherent fluorescent properties of flavins. The assessment of riboflavin status is essential for confirming cases with unspecific symptoms where deficiency is suspected. Glutathione reductase is a nicotinamide adenine dinucleotide phosphate and FAD dependent enzyme and the major flavoprotein in the erythrocyte. It provides a measure of tissue saturation and long-term riboflavin status. Experimental balance studies indicate that urinary riboflavin excretion rates increase slowly with increasing intakes until intake level approach 1 mg per dl when tissue saturation occurs. At higher intakes, the rate of excretion increases dramatically. Toxicity. Toxicity associated with large oral doses of riboflavin has not been reported and no tolerable upper intake level for riboflavin has been established. However, very high doses may cause itching, numbness or This episode so far focused on the functions, deficiency and assessment of riboflavin. Let us summarize the episode. In this episode, we got to understand the recommended dietary allowance and requirements of riboflavin, its role in human body. We also learnt about the deficiency and toxicity of riboflavin. Riboflavin or vitamin B2, an easily absorbed water-soluble micronutrient with a key role in maintaining human health, supports energy production by aiding in the metabolism of fats, carbohydrates and proteins. It is also required for red blood cells formation and respiration, antibody production and for regulating human growth and reproduction. It is essential for healthy skin, nails, hair, growth and general good health, including regulating thyroid activity. Riboflavin deficiency results in the condition of hypo or arabinoflavinosis with sore throat, hyperemesis, edema of the pharyngeal and oral mucous membranes, cheilosis, angular stomatitis, glossitis, seborrheic dermatitis and normochromic normocytic bone marrow. The major cause of hyporiboflavinosis is inadequate dietary intake. Thank you students. Hope you understood today's episode. Thank you once again.